Rural healthcare providers are facing a ton of uncertainty right now. Looming cuts to Medicaid, workforce shortages, and razor-thin margins. It feels like the ground is shifting under your feet as funding disappears. But there's $50 billion coming over the next 5 years that a lot of healthcare providers don't even know about. It's called the Rural Health Transformation Fund. But here is the hard truth. The funding comes with some strings attached. And if your clinic doesn't understand how that money flows, you could end up with nothing. Understanding the program and who controls the funding is key to ensuring that your rural hospital isn't forgotten about. So let's break down what the program is, how it works, and most importantly, how to adjust your strategy so you don't miss out. Let's start with the basics. What is this money? The Rural Health Transformation Fund was designed to give financial help to rural communities. As changes take place to Medicaid, rural residents are expected to be the hardest hit. So this funding is meant to serve as a $50 billion bridge. It can help rural health centers keep their doors open all the way through to 2030. But it's not a grant that you can just apply for to keep your lights on. It's meant to transform the way rural healthcare is provided. It's a 5-year runway to build a sustainable model that can survive in the future. But simply knowing that money exists won't help you get it. You need to know who holds the checkbook and what their priorities are. This is where a lot of providers get confused. You're not applying to the federal government. You're not sending a proposal to CMS in Washington. Instead, the federal government is sending their money to all 50 states. The states then fund programs to reach their goals. The federal government is sending out $10 billion per year for the next 5 years. Half of that is divided equally between the states, meaning that each state gets at least $100 million. But the other half, that's where this gets interesting. The other $5 billion is split based on discretion and performance. CMS decides how much each state gets based on how aligned they are with federal priorities. They also factor in how many rural residents each state has. The states have already put forward a plan on how they're going to use this money. And the federal government has announced how it's all being distributed in the first round. This means that your rural clinic needs to review the state's priorities. Because if your clinic is not helping your governor hit their goals, you will be left out. In order to know if you're eligible for the funding, you'll need to know if you count as a rural health facility under this new law. You might be thinking, I'm not a traditional hospital, so this isn't for me. Wrong. The definition is much wider than you think. Yes, it covers the traditional hospital, but it also opens the door for rural health clinics, federally qualified health centers, mental health centers, and opioid treatment programs. And pro tip, even if you're located near a city, if you serve a rural population, you may still qualify. Check the census tract to be sure. Now, let's talk a little bit about the strings attached that I mentioned earlier. To get this money, you have to align yourself with the state's goals. Every state submitted a rural health transformation plan to the federal government making specific promises. Your proposal to your state must help keep those promises. For example, many states talk about using mobile clinics. So tell your state you can use the funding to help start a mobile clinic, and take it a step further, using it to align with other goals. For example, Alabama promises to provide mobile cancer screening. Write a proposal to be that service. By the way, if you want to know how to start a mobile clinic, we have a 3-part series on that located up here. Another example is if you're in Florida, write a proposal on how you'll enhance technology and data usage through telehealth. Pitch a generic renovation to your clinic? Denied. Pitch a program that aligns with your state's goals? Approved. Don't ask for money just to survive. Ask for funding that helps your state keep its promises. So, what can you do today? Number 1, don't write a generic grant. You need to become a partner in your state's strategy. Number 2, review the state project abstracts document. Find out what your state promised to deliver. I've linked that document down below. And number 3 is to tailor your pitch. Whatever your state is promising, Write a proposal to deliver on that service. Did they promise workforce retention? Pitch a residency training program. Reduce heart disease? Pitch a heart screening mobile clinic. Connect the dots for them. Show them that by funding you, it helps them get more federal money. That puts you at the very front of the line. So to wrap it up, the Rural Health Transformation Fund is a massive opportunity, but it certainly brings some challenges. The winners will be those who offer solutions, not just problems. Funding is very hard to come by these days, but knowing how to tailor your presentation is absolutely key. And if you work in addictions treatment, you should check out the opioid settlement funds. It's a massive funding opportunity that many states are struggling to spend. We have a video that covers it, and I'll put it up here for you. Make sure you subscribe to our channel to find out more about future funding opportunities. If you have any questions, please reach out. We're always here to help.